Welcome, welcome, welcome. My name is Mikkel Thorpe, and this is the Expat Money Show. Today's guest is the CEO and founder of CrowdHealth, a company that uses a voluntary crowdfunding model to pay its user medical bills and even help them when they are overseas. Please welcome to the show, Andy Schoonover. Andy, how are you?
I'm doing well. Thank you so much for having me.
My pleasure. This episode kind of fits into our decentralized health, which is becoming a bit of a theme on the show, I would say, in 2024. So maybe take a minute and kind of walk us through your backstory. How did you end up founding CrowdHealth, and why did you think it was necessary?
Yeah, this is actually my second healthcare company. And after the first one, I never thought I would do it again. But life situations just kind of occur and throw you into the opportunities. So I sold my previous business, came off of that. In the United States here, we typically will get our health insurance through our company. And so since I didn't have a company anymore, I didn't have health insurance. And so I went to healthcare.gov, which is a government sponsored marketplace for health insurance plans. And got that as, I think, $1,200 for me, my wife, and my two girls per month. And it worked until I had to use it. My little one, who was one at the time, was having recurring ear infections. And so we went to the ear, nose, and throat doctor, who said, oh, yeah, she's got a perforated eardrum and you have to get tubes in her ears. So we went and got tubes in her ears, got the bill, and it was a 15-minute procedure. It cost us $8,000. I'm just like, holy crap, $8,000 for a 15-minute procedure. And little did I know, a few weeks later, the health insurance plan was going to reach out to me and say it was medically unnecessary, and so they weren't going to pay for it. So what my doctor told me I should do, and got actually pre-approved by my health plan decided after the fact that they weren't going to pay for it. And so I had to stroke an $8,000 check to the local hospital to pay for this surgery. And at that point, I was pissed, as you can probably imagine. I called the health insurance plan. I said, I quit. If you're not going to pay my bills, I'm not paying your bills. And so my family and I have been uninsured now for about 4 years. And we started building tools to allow people to operate outside of health insurance. That kind of came into a company. I mean, we were doing it. We were trying to figure it out. We were like, I bet you other people would like to do this too, since everybody hates health insurance. And CrowdHealth was born of that. So that's kind of the origin story of the company, but it just comes from, hardship, like many of these entrepreneurial companies. That's the origin story, right? Somebody comes through something really, really difficult, and you're like, I can solve this. Let's figure this out.
So is that a normal practice in the States for doctor to say something needs to be done? Patient goes forwards, insurance company afterwards goes, whoa, whoa, whoa. That's actually not needed. Like, I would have thought that it would have been the doctor who would get to make the decision, not the insurance company on the back end.
Yeah, unfortunately, in the United States, we have a health insurance company that stands between the patient and the doctor, and it gets to decide what can and cannot be done to the patient. So there is no real patient-doctor relationship here. It is a doctor that reports to a health insurance plan to get paid, and therefore, there's an intermediary here, which I think is a little bit silly. I always say that you work for whoever pays you, and the doctor gets paid by the health insurance company. And so the doctor does not work for me if I have health insurance. He works for a health insurance company who does not have the same outcome requirements as me. And so, what we learned is if we pay directly the doctor now works for me. I'm the patient, I am the customer, and the whole dynamic changes. So it's a pretty wonderful thing when you get to see it. The doctors are relieved, actually, that they get to actually work with the patient and decide what's best for the patient with the patient, and they love it.
Well, because I've had premium level health insurance while being overseas for many, many years, but I don't think I've ever had anything refused. I don't know if it's because the prices are so much cheaper. So for the insurance company, it's just like, just pay it, or if it's actually a different systems or it's a different incentives that's set up.
Yeah, I don't know. It's probably not a U.S. based insurer, is my guess. It's probably some other, insurance plan. I guess I candidly, I don't know a whole lot about how it goes with expats who, have insurance from some other entity than a government. And so this is a major, major issue within the United States. And in fact, about 20% of the time, your claim is denied. So you have a 1 in 5 chance of your claim being denied. So, if that's a little bill, like $150, office visit, it's not that big of a deal. When it's an $8,000 bill or a $25,000 bill, as you can imagine, that's a huge issue. And in fact, the number one reason why Americans go bankrupt is due to healthcare costs. And about 75% of the people who go bankrupt due to healthcare costs actually still have health insurance. So you have health insurance, you're still going bankrupt because of a medical issue. That's a major, major problem.
Okay, as a non-American, I can tell you, okay, there's 193 countries in the world. I'd say 192 of them are looking at the United States, and the majority of people on planet Earth have no idea, me included, why the US healthcare is so expensive. Like, why is it 5x, 10x than any other country on planet Earth? Why every international health plan will cover you on every country in the world except for the US? Like, what is it about the US that has just made it so, so, so expensive?
Yeah, it's a great question. And actually, the answer is pretty easy. You have the buyer of healthcare and the seller of healthcare. The buyer of healthcare is health insurance plans. And so in the United States, we actually have a law that the insurance plans can only make 15% of your premiums as profit. Okay. So if you have $1,000 premium, they can only make $150. So how do they get to 100? How did they get their revenue to grow by 10%? How do they get that revenue to go from $150 to $165? Well, your premium has to go from $1,000 to $1,100. So they actually have an incentive to see your price of your health plan, your health insurance on a monthly basis go up. So you have the buyer of healthcare who wants the prices to rise, and then the seller of healthcare is these big hospital systems. They obviously want the price to rise. They want to get paid for, more for the same goods, year over year. And so you have the buyer of healthcare wanting the price to rise and the seller of healthcare wanting the prices to rise. And so it doesn't take, an economist to figure out when you have the buyer and the seller both wanting the price to go up, the price goes up. And so we just have a perverse incentive system within the United States owned by some of the largest corporations on the planet, United Healthcare, CVS, both are in the top 10 largest companies on the planet in terms of revenue. They own our healthcare system. So unfortunately, that's just the system that we've been given. And it's a shame because it's putting around 200,000 to 250,000 families in the United States into bankruptcy every year.
Because as a Canadian, we're kind of taught that, socialized medicine is everything. And because we have socialized medicine in Canada, we don't have the problems that they have in the United States. Like, people in Canada are not going bankrupt from, expensive medical bills. We have the opposite problem where it's like, okay, healthcare is free, but you don't actually get to see anything or get anything done. So you get a whole bunch of free nothing. So it's like a completely different set of problems. And both of them sound very bizarre to me and really, ripe for disruption, let's say.
Sure. Yeah. I mean, I think there's a saying that you can have, you can pick two out of the three: speed, cost, and quality. Which two out of the three do you want? And in the United States, we've chosen speed and quality, and we have really high prices. We don't get that one. In the in Canada, you've prioritized, cost, right? And I don't think you definitely don't have speed. Quality is a question mark, right? And so I would say it's higher than the average. So you're taking quality and cost, and speed is the thing getting left behind. So, it's very, very difficult to have all three. And while the United States healthcare system is absolutely horrific, I truly do believe we have the best doctors on the planet. If you have a very complex condition, you want to be in the United States. Saudi royal family has whole floors of hospitals in New York City. reserved just for them because they want to come to, the best hospitals in the planet, which I think are in the United States. So, we get quality pretty good, but the cost is horrific. I mean, and so the payment system needs to change. That's ultimately what we're trying to do is how do you pay differently and get, the same quality, the same speed at just a little bit of a lower cost. And that's what I think we figured out.
No, that makes perfect sense. Absolutely. What are some of the other problems that you're seeing in the United States that really showcases the need for a change in something like this?
Yeah, I mean, I think that another one of the big problems that we have in the United States, and I think we're starting to see this trend through the rest of the world, is obesity. I think that people, when I say that the United States has the highest quality, they're gonna, come back with, oh well, you're pretty low down on the charts in terms of quality rankings that some of the OECD, surveys generate. My argument back to that would be like, well, the United States doesn't do as well on some of the quality scores. However, if you adjust them for obesity, then we actually do very, very well. So the United States tend to be 50% more of the population is obese than the rest of kind of the developed world. And as a result of that, we just have poorer outcomes. If you think about a knee replacement, for example, a knee replacement works really well on somebody who's 5'10", 180. It doesn't do very well on somebody who's 5'10", 450. And so you're going to have reduced quality scores as a result of that. And as we all know, obesity you're about 10 times more expensive if you are obese than if you are of good health, good weight. And so I think we have a food problem here in the United States. I think big corporations own the day in the United States. There are, thousands of ingredients that are outlawed in other parts of the world that are actually legal here in the United States. And I think it's, have a significant impact on our health generally. So the rates of chronic conditions, diabetes has gone from 1% of the population in the United States to 10% of the population over the last 50 years. And that's a huge issue. 25% of our $4.5 trillion we spend in the United States goes to diabetes, people with diabetes. So that's a significant issue that we're going to have to resolve.
Well, definitely living down here in Latin America, we don't see that kind of level of obesity or diabetes or anything like that. Even, I mean, Panamanians, they love their Coca-Cola and Sprite and things like this, but still, you're not seeing like massively obese people walking around the street. And I think for a lot of foreigners, when they come down to Latin America, because of the nice weather, they're outside more, they're swimming or surfing or going hiking or doing activities. And then a lot of the food is just naturally organic, or they're eating more, fresh seafood caught in the ocean that morning. This is not a big, fast food. Not to say that it doesn't exist here. If you want it, you can get it, but it's not on every street corner. You have to more go out of your way to find it, opposed to it being in your face every minute of every day. And then we don't have the Monsanto crap that's sprayed all over everything and the genetically modified. It's more of a natural type of food. So I think it's another one of those things. Because I live overseas, it doesn't really, the obesity or these types of things, it doesn't come to my mind immediately because I just don't see it here.
Yeah, I mean, I think that's totally right on. Absolutely right on. Again, we are owned by big corporations in the United States. They pay our legislators to write laws. I think there was recently, I think it was within the FDA, Food and Drug Administration here in the United States. They've got a panel of people that recommend what is people should be eating. And I think all but one person on that roundtable has been paid or is currently being paid by either big pharma or big food. And so clearly their incentives are to promote the people who are paying for them. Again, you work for whoever pays you. And so you need to follow that incentive structure, and it's pretty perverse, all over the place. So yeah, we eat crap. Our system is built so that it's really, really expensive when you eat crap. Having a heart attack and having a heart surgery is going to be 150 or $200,000 in the United States, and so all of those things are just built upon one and each other just to feed the animal. Bad food leads to high health costs. High health costs leads to lots of pharma. Lots of pharma leads you back into bad health. And so it's just this never ending kind of vicious cycle that we've gotten ourselves stuck in. And people have to make a decision to get outside of that cycle and kind of what we talked about before we started, kind of decentralize their health thinking to get back to where we need to be.
Well, and if you consider that this show at the core is about freedom, and for me, one of the best ways to have freedom is to be financially free, to have economic freedom on these types of things. And going back to your points on medical bankruptcy, that's the opposite. So you eat bad food, you have high costs, you go bankrupt. Now they've taken away your freedom of mobility, your freedom to provide for your family, your freedom to walk away from possibly a job which doesn't align with your values or makes you want to participate in things that you don't philosophically agree in. So it is a downward spiral in a lot of these types of things. And that's the opposite of what we're looking for. We're looking for an upward spiral and providing people with real life solutions on how they can have freedom in their life. Now, my wife is from mainland China, and looking at things from an Asian perspective, which is, we speak Mandarin in the house. Like my kids all speak Mandarin, and my wife speaks Mandarin, and we kind of look at the body as a whole, as a complete system. Now, I think Western medicine does a phenomenal job at trauma, like treating trauma, Western medicine, Western styles, fantastic, amazing. But I'd say overall health, they're really lacking in a lot of ways. And a lot of the society is built, as we're discussing, not in a way that you're going to be healthy, but in a way that you're going to be unhealthy.
Yeah. Yeah, I totally agree with that. I mean, I think that what you're saying is let's get to root cause here as opposed to just treating symptoms. And I think from what I've seen is Western medicine treats symptoms. You go into the doctor, you tell them what's wrong, the doctor gives you a medication. And that is just treating the symptom of an underlying problem. From what I've seen in Western medicine and some of the naturopathic, holistic, functional medicine groups here in the United States is let's look at root cause. Let's figure out what is going on with your body as opposed to just treating the symptom. Because if you treat the symptom is going to come back. If the symptom does come back, I now have a human being that's a source of recurring revenue for me. It's just more profitable to have somebody with recurring symptoms because they got to keep coming back. They got to come back for more doctor visits. They have to come back for more pharmaceuticals. They have to come back for more prescriptions. They have to come back. And it's a recurring revenue cycle that everybody wants in their business. If I find root cause, they may never come back. That's bad for my business. If I'm one of those doctors, it's actually good for my business, but bad for a doctor who doesn't have that recurring revenue. And so that's, again, one of the perverse challenges within our system. And, I think that the more times that you can pay for something, directly, so it's coming from you, you then have an incentive to reduce that cost. You have an incentive to look for the root cause. You have an incentive not to go back to the doctor's office, not because it just costs a lot more money, but because nobody likes going back to the doctor over and over and over again and feeling like crap every single day. And so now I have an incentive to go and really try to figure out the root cause. And so we need a lot more root cause medicine, which I think Eastern medicine is significantly better than Western medicine at figuring out.
100%. I mean, the holy grail of business is continuity. If you can have continuity in your business, recurring payments, that's fantastic. I do it in my business. We've got a membership program. It's called The Hub. It's $2,000 a year. But you know what you're paying for. Like, there's nothing sneaky in there. We provide as much value as humanly possible to you. So at the end of the year, when it comes up to auto billing, you're happy to pay that money because you feel like you've gotten way more for it. With what we're describing here with Western medicine and a lot of the healthcare, quote unquote, is it's very sneaky. It's very sinister, a lot of the way that things are set up, and exactly how you're explaining on the incentive programs, how doctors are incentivized and how the hospitals are incentivized and the insurance companies are incentivized. It's not necessarily your best interests at heart. And don't get me wrong, like I love my doctors. I would say, probably a quarter of all of my private clients for my company are doctors. And they also realize that a lot of the things are broken in the system and a lot of them just don't want to participate anymore. I have doctors now who are 48, 49, 50 years old who are doing early retirement. And they're like, you know what? I don't want to deal with the insurance companies anymore. We take their nest egg, we move it overseas, we diversify it into cash flowing assets, and cost of living is a half, a quarter, a fifth of what it is back home. And
Yeah.
it's just like, go and enjoy your life and don't have all these stresses. And when you think about the chance of being sued in the United States, in the most litigious country in the world, for doing something as a doctor, it's a rough deal. I mean, it's not like it used to be before. So I don't know. It's a
Yeah.
difficult situation. I think a lot of people are in.
It is. And anytime you consume a good or a service that you don't pay for directly, so a third party pays for, and in our case, an insurance company, there is just an inevitable consequence of that you're going to consume more, right? Like if I'm, go to the car dealership and I can get an entry level, sedan versus a, souped up SUV, and I don't have to pay for it. I'm going with the souped up SUV if I'm not paying for it. If I'm paying for it, I'm going with the entry level sedan. So we just have a consumption issue that is fueled by somebody else paying the bill, and so that again is a reason to make personal responsibility a greater part of the healthcare equation, because I think that leads to better health, lower cost, consumption goes down for a variety of reasons.
Okay, so before we get into the solution, which I'm super excited to understand what you figured out as a solution, I just want to kind of understand, if we don't do anything, are things just going to magically get better on their own? Is the trend actually getting more positive? Is it getting more negative? What is the direction in the United States right now?
Yeah, I mean, I think we're going in a tough direction. We talked about, I think the big companies, own a lot of our legislators. I don't think we're going to get any laws that are passed that are going to significantly impact this. I think that private equity is also playing a much, much larger role in our healthcare system. So, for example, something like 80% of doctors were independent a decade ago. An independent doctor means they have their own practice. It's now down to 20%. So it's gone from 80% to 20% over the last decade. And so why has that been? These local hospital systems are gobbling up all these local practices so that you are now a part of their system. And you no longer have, or very few, the local family doctor who's on their own, who's not influenced by the big hospital system, because once you're in the big hospital system, it's hard to get out of that. So they're going to they're employed by a hospital system. They're going to want you to go to this hospital. They're going to want to get your labs done here, and that's hospital owned. They're going to want you to do your imaging here, and that's hospital owned. And anytime you go to a hospital based service provider, they are at least 3 times more expensive than an independent. So that is a massive, massive problem. Once I did a little video where I was sitting in the airport, and so maybe you have expats, you have people all over the place, who get this. You walk into the airport and you buy a bottle of water. In the United States, you can go to buy a bottle of water in the airport for $5, right? If you get a bottle of water outside of the airport in the grocery store, it's about $1, right? So why are you paying $5 for a bottle of water in the airport? Well, you're trapped. Right? You can't get bottled water from anywhere else. The hospital systems do the exact same thing. If you get a service within that hospital system, it's 2, 3, sometimes 4 times more expensive than if you were outside of the hospital system, because they try to trap you in that system and make it very difficult for you to get out. So one of the things that, people are listening to this in the United States and maybe even other places, go try to find independent doctors. That's the number one way that we have found to reduce costs. These are doctors that are free from the perverse incentives of big hospital systems. They're on their own, just trying to make a living. It's between you and them. Man, it's a beautiful thing if you can find that doctor. Sounds like you've got some of those doctors down in Panama. If you're listening to this in the United States, find that independent doctor, call them up, ask them, are you independent, or are you a part of the local hospital system? If they say independent, then more than likely you have an independent thinking, think outside the box, root cause, focused type of doctor, that would be my big suggestion.
Now, that makes a lot of sense. And that definitely goes in with our thought process on resiliency, getting to know the people in your community, not just being insular, just to yourself. I mean, get out there, make friends, talk to strangers. I talk to my kids. I tell my kids every day. I got 3 kids. Go talk to strangers. Go talk to strangers. Like make friends. Open up. People have skills, trade skills, barter. Anything you do can do to strengthen relationships. And absolutely, when you come overseas and be an expat, this is one of the most important things. We know the farmers. We know where a lot of our food is coming from. With our Veritas project, where
Man, I love
we're
that.
connected in that, and we have doctors who are in our communities, who live in our homes and things like this. It's like same with the chiropractor, same with the dentist, same with everybody. Get to know them, make personal relationships. Don't just be dealing with big conglomerates all the time, because really you're not a human being in a lot of cases. You're just a number. They don't really know you. They don't know your family. They don't know your values. And I think that the more we can go to a more decentralized type of version of things, I think the better off we're going to be on every level.
I love it. I love it. Totally aligned with, our vision. So I love that perspective.
So talk to me, Andy, a little bit about some of the solutions that you found. You hinted at some of the tools that you've been able to build. Put some meat on the bone. I want to kind of understand, because you might be listening to this episode and going, "Wow, that's pretty dark scenario we've kind of painted at the moment." Explain to me what you've been able to figure out so far.
Man, I feel like you just teed it up beautifully. Like, the fact that you've got a community down in Panama,
Not just
it's
Panama,
something that
not
we
just
have
Panama, in
lost.
about a dozen different countries right now. So
No, I believe it, and I believe it, and that's the way it used to be in the United States in the 1980s and 1990s, I would say, and it's over the last 2 or 3 decades that we've lost that. Before, we used to have a neighbor who would come next to us, who'd move next to us, and we would bring them cookies or whatever to welcome to the neighborhood. We just don't do that anymore. In most parts of this country, we don't do that anymore. And instead, we look at the purchase price of the home just to see how much our home is worth. Like, we're way more interested in that than we are our next door neighbor, right? And so, what I'm trying to do is let's bring that community back to healthcare, because what I think government has done, what health insurance companies have done, is they said, hey, don't worry about it. You don't have to worry about your neighbor anymore. I've got them. Don't worry about it. The government's got it. The government is here to take care of you. Don't worry. I think, what is that Reagan said? Like, those
yes,
words, knock
Reagan,
on the door. I'm the government and I'm here to take care of you,
to
or
help
something like
you.
that, right?
Yeah, I'm here to help you.
And so and so the government insurance companies have wedged themselves in between us and our neighbors. And I do believe that community is a very important part of the human condition, and we have lost that in many places on this planet. And look, I'm not saying like communal or like socialistic or communistic or anything. I'm like, no. If we can get a community together of people who take personal sovereignty, personal responsibility over their being, their whole being, and not relying upon others for them to survive, that's the community that I want to be a part of, right? Like, so I'm saying, like, we love community. And so what would happen if we got a bunch of people who are, personally sovereign, took personal responsibility, very as a high priority in their life. We put them together and we say, hey, y'all, pay for your healthcare expenses individually. You got this. You know what? If something big pops up, then let's bring that to the community and let the community help out. And so that's in essence what we have done. You are personally sovereign over your own healthcare expenses, but if you have something big, bring it to the community. And so this is how this works, like in actuality, right? If you broke your arm, let's just say it cost $5,000. I'm going to make up a number. You'd pay the first 500 of it. And then the remaining 4,500, I would go to 45, CrowdHealth would go to 45 people in our community and say, hey, would you help Mikhail with his broken arm? And they would say yes or no. And if they say yes, then $100 goes from them to Mikhail. And so at the end of the day, Mikhail has, $4,500 plus his $500 is $5,000 to go and pay in cash for your broken arm. So what's the beauty of that? Well, in the United States, if you pay in cash, you're getting about 50% better rates than if you pay through an insurance company. So the doctor will knock off 50% of the price if you pay him in cash, right? Because the doctor no longer has to deal with the insurance companies and the bureaucracy of that and all that kind of stuff. And so that's the benefit of that. And
Well, and I'm sure he
or
also gets
Mikhail,
paid. I'm sure he also gets paid a lot faster as well, because I would imagine that the insurance, if they were going to pay, it
exactly.
was going to be a really
Yeah.
elongated process. And the money in his account today, what do they say? One in the hand is worth two in the bush. So,
Yeah, exactly. And so typically doctors get paid in like 2 to 3 months. So imagine you doing your work for your employer, who's ever listening, and not getting paid for 3 months. Or a lot of your folks are freelancers and gig workers. I'm assuming. What if your client, you did your work for your client, your client says, "I'll pay you in 3 months," and you're like, "Wait, hold on a second, like that doesn't make any sense." And so that's what these doctors have to put up with, is they don't get paid for 2, 3, sometimes even longer than that. And they have to spend about a day out of their week fighting with the health insurance plans to get paid. So now, if you're a freelancer, imagine you can't work for a full day because you're fighting with your client to get paid, right? Like that's the analogy that I'm using here. So it's significantly less expensive if you can pay in cash at the point of care for some of these big procedures. So then you might ask, like, okay, so why would anybody give to Mikhail for his broken arm? Like, I don't know Mikhail. Like, I don't know who that person is. Like,
come on, guys. I'm
well,
pretty
we
cool. Come
actually
on.
will
Give
tell you.
me.
You are cool. You are cool. I do know you now. And so, I would give to you if I knew it was you. But, when Mikhail asks for funds, we actually see what Mikhail has done, has said to other people. So has Mikhail said yes, 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 yes to the other people, or he said no, 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 no to the other people? And so if he said no, 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 like, you're not a really good member of our community. Like, why are you in our community? I'm not going to help you if you're not helping anybody else. You're a taker and not a giver. And so, we let you know that as a part of that. So people are incentivized to be a good member of the community. The analogy I make is, if my next door neighbor was partying all night long and kept me up until 4 a.m. in the morning, by rocking out. I have two young kids. That would not be a good thing. And then asked for, some milk or butter or whatever the next day because they ran out. The probability of me having that is much, much less than if he were to have gone to bed at 9 o'clock. I can guarantee you that, right? Like, if you are a good member of the community, other people will step up to help you. If you're a bad member of the community, people are like, you shouldn't be in our community, right? Like that, you're just not a very good member of our community. So we use a lot of those community dynamics. In essence, what we're doing is building a community of people who will help each other out. Here's the super cool thing about this, though. I know exactly where my money is going this month. Like, I know that my $100 is going to Mikhail to help him with his broken arm. It's not sent to an insurance company where I have no idea where it's going. Like, it's not like, man, this sucks, I have to pay my insurance company again this month. Whereas with us, it's, oh, I got to help Mikhail with his broken arm. About 6 or 9 months ago, we had a woman who had a miscarriage. There was costs associated with that. And so we sent out something to a couple hundred members, and we got feedback from our members to be like, man, I know what this feels like. I know what a miscarriage feels like. I know the pain that this woman is going through. Instead of $100, can I give her $200 because I want to help this family? It's like, never in a million years would you call your insurance company and be like, can I pay you twice this month what I should be paying? But it's that human to human connection where I know I'm helping somebody with or something really, really difficult that they are going through. It's like, man, I any day of the week I'd help somebody out with things they're having problems with. I'd way prefer to do that than send it to United Healthcare or Aetna or one of the other big insurance companies here in the United States. So that's one of the coolest parts, I think, of our model, is we're helping other people directly. We kind of say fund humans, not health insurance. We're funding other human beings as opposed to the insurance middleman.
Well, little side tangent, not exactly on health or insurance, but definitely highlighting the point that you're making about helping the community. I interviewed a gentleman named Gret Glyer, who, funny enough, you've been on the Tom Woods show before. I've been on there a couple times. I think Gret had been on there. He's not with us anymore. But I interviewed Gret Glyer about 3 or 4 years ago on my program and actually helped him get connected with the nonprofit that I work with in Africa, in Uganda, called 1018. And over the weekend, my partner at 1018 sent me a video that we had successfully crowdfunded 350 projects for the nonprofit that we do over there, and it was a huge celebration. And their entire basis of DonorSee, which was his company, was to show exactly where every dollar went and how it's actually being used. It's not this massive multinational company or insurance company in our conversation, or the Red Cross. You have no idea where the money is going to. It's going to administrative work and oak dining rooms and filet mignon and private jets and things like that. It's really going in the hands of people, and
Yeah.
our community has helped fund over 350 projects for this nonprofit, as well as a literacy program and a ton of other things that we do at 1018. And people, when they can see where the money goes and that it actually affects another human being and in benefits their life, I think you will find that people are actually very generous and very willing to give, very happy to do so.
Yeah, and funny enough, our model is kind of inspired by Kenya. There are communities in Kenya who do the exact same things I'm talking about. Is they all put money into the bucket, and when somebody else in their community needs help, then they take some money from the bucket and go and get the healthcare that they need. It's also inspired by the Amish here in the United States. Same thing is they're a community of people who share the same values. And, the health outcomes, I don't know if you've seen this report, but the health outcomes of the Amish in the United States as they relieve themselves or release themselves from health insurance plans have been astounding. I mean, they have almost zero diabetes, zero, percent type 2 diabetes in the Amish. They have almost zero autism. They have almost zero ADHD or some of those other psychiatric, issues. And so if you can relieve yourselves from that, centralized insurance, healthcare, medical industrial complex, then I think you're actually going to see much lower prices, much better health. And we've seen that in multiple, communities in the United States and abroad.
Well, as our conversation highlighted before, it's the exact opposite, because right now what's happening in standardized medicine and with the big pharma, big healthcare, big hospitals is they want to take away your power. What you're really describing, Andy, is giving people their power back. You're helping them to realize their power.
Oh, absolutely. Absolutely. I mean, that's what the number one piece of feedback is we get. It's CrowdHealth feels freeing. FREEING, freeing. And I'm like, man, I love that. Like, because shouldn't your healthcare be free? If anything should be free, shouldn't it be your personal bodily autonomy? As opposed to having an insurance plan tell you what you can and cannot do with your own, your own health. That seems very, very strange to me. And so let's take back that freedom of our own bodies and be responsible for them. And I think when you outsource your healthcare to somebody else, then your incentive to keep your body fit and ready for your 80s and your 90s, that's decreased. So I always tell my people, I want our members to be able to play wiffle ball with their grandparents in the back, wiffle ball with their grandkids in the backyard. For people who don't know, wiffle ball is like a backyard form of baseball. And so, if you can play with your grandkids while you're 80 or you're 90 in the backyard, that's what I want for our members. And that only can happen if you can, again, release yourself from the big pharma, the big food and things like that. So, live hard and die fast. Like, nobody wants to die slow. And so I think that getting rid of the intermediaries allows you to do that much more effectively. So that's my big vision. I mean, this is my second company. I sold my first one. I sold it for a lot of money. It was an awesome outcome. This one is missional for me. This is one where I truly want to see people thrive and outside of the medical industrial complex. And I'm trying to build a company that allows people to do that. So, It's been a fun run. I'm having, just a huge enjoyment talking to folks like you to spread the message.
Let's just replace wiffle ball with pickleball because down here in Latin America, pickleball has like
Pickleball.
taken
There you go.
over
Everybody gets
everywhere.
pickleball now. Yeah.
Holy moly.
Or
In Latin
football.
America, here in Panama, pickleball is like the craze. Like people are going nuts for it here. Okay, we talked a lot about
Yeah.
community.
Well, I'll give you a
Now,
quick pickleball
all right, pickleball story, and then I got
example.
a,
We
a
had
community question.
okay. Yeah. We had a member who was playing pickleball and tore their ACL. Went to the orthopedic surgeon. Orthopedic surgeon said it was going to be, I think, $24,000 to fix their ACL. She calls us up. We call the surgeon. We say, hey, if this member can pay you at the point of care, how much reduction would you get? It went from 24,000 to 12,000 just by paying at the point of care. So that's our pickleball story. It was a great outcome. $12,000 to repair an ACL is actually a reasonable price. So there's my one pickleball story.
Amazing.
Be careful
now, on
out
the
there.
Okay, actually, another pickleball story. So I was out with my mother and a bunch of clients for dinner. This is maybe 3 or 4 months ago. And we're all having dinner. There's maybe 10 of us at the table. And my mother's like, "What's pickleball?" And I was like, "Yeah, it's kind of like tennis, but instead of a ball, it's in the shape of a gherkin. And when you hit it, it kind of bounces all over the place because it's like not round." She's like, "That's amazing. Wow, I want to see this." And we had her going for probably about 20 minutes that you were hitting around the court a gherkin, a literal pickle. So
That's funny. Ah, that's hilarious. I love it.
So on community, let's dig into community a little bit because I think it is at the crux
Mm-hmm.
of so much of what we do. And I spend a lot of my time, thinking about it, philosophizing about it, meditating on it, what builds a good community, what goes into it, how do you nurture a community, how do you let people grow the community without you, how do you not build the bottleneck being yourself.
Mm-hmm.
Talk to us a little bit about your community, Andy, because I am going to guess that your community is not just complete random strangers. There's got to be some other tie more than just the healthcare aspect, or maybe there's not. Tell me if I'm wrong.
Yeah, when I first started the company, so I started the company in April of 2001. We launched in October of 2001. So it took us about six months to get the tech back end figured out. And I went on 75 podcasts between October of 2001 and December of 2001, or 2021, excuse me. And I went on everything from an anarchist to, I'm trying to remember what the other one, but it was three transvestites talking about their daily lives. Like I went the whole spectrum of like political, whatever. And what I found is that the people who really resonated with this are people who are, libertarian leading, who are high on personal responsibility, and don't like subsidizing other people who are not high on personal responsibility. Right. And so, most of our members fall into kind of three different categories. One, they are against kind of the worldwide financial system that is governed by the dollar primarily, given the Federal Reserve can print and print and print money with kind of no recourse. We have no recourse by them printing money. And we're feeling it, right? We're feeling the pain of that. So that's the first one. The second one is they're anti big food, and so they are not being psyoped by the big pharmaceutical companies telling them that they have to put vaccines in their body, they don't have to take statins on everything, and all these kinds of things. So they're anti Western medicine, and the third one is they are it's kind of tied in with the second one, but they are natural holistic, root cause based type of people. They want to get to the root cause. So all of these communities that we have built revolve around one of those interests. So we've actually got a Bitcoin community. So if you're in a Bitcoin, we've got a group of people who are just funding each other who are Bitcoiners. We're actually building a financial rails over the Lightning Network. So for people who understand Bitcoin, they get what that is. We actually have a carnivore crowd. So we have a group of people who all share the love of animal-based diets. And they are just funding each other. And we are about to start a naturopathic holistic group where just people who are in a naturopathic and a holistic medicine can fund each other's healthcare expenses. So these three groups have something very in common with each other. And what we're finding is that if you are a member of your own, if you're a part of a tribe, if you feel like you belong to something, then there is significant behavior change that results in that. Because now when I go to the hospital, I know that I'm going to ask others in my community to help me as opposed to a big corporation, right? I don't care if I ask United Healthcare for $100,000. I care if I'm going to ask another person in my tribe for $100,000. That's much, much harder. It personalizes this for you. And so we're seeing significant behavior change, both personally, like how I take care of my body, but also how I act within the community to benefit that community. It's a beautiful thing. We had a guy with colon cancer, so probably one of the worst forms of cancer that you can get, call us. And he said, look, please, can you help me find the best doc possible? But please, will you help me negotiate this so I don't, quote unquote, screw the crowd, the crowd that he was in. He's like, that's just a totally different way of thinking about healthcare than if you're with an insurance company, because you don't really care what it costs with an insurance company. You do care what it costs when you're in a community of people. And so we're seeing that community play just a huge role in how we operate and keeping expenses down. So that's the role of community here. I mean, we're still trying to learn how we, grow that community and be a part of that. We're having 100 of our members show up to the Bitcoin conference in a couple weeks, in Nashville, which will be a lot of fun. So we're trying to figure out ways to build that community, but people do feel like they're a part of something, which is very, very special.
Well, I think it is so radically different than what we see on other sides of the aisle, let's say, or in some of the woke crowds, because a lot of that really is alienation. It's an alienation of you from society, from your neighbors, from your own body, from the community, from the church, an alienation from your kids, your family, your parents on every level. And I really feel libertarians, agorists, and caps, a lot of us, lowercase L, absolutely lowercase L. I don't know anything about the political party, but, with personal responsibility, it is about connection. It's about humanity. It's about helping one another and personal responsibility. And then when we take into things like that, where, we have something in place that is going to help you in, like your example with colon cancer, which must be absolutely horrendous. But let's take another example where it's like, someone just taking care of them on a daily basis. Like, absolutely. If someone is, exercising and eating well and, then they need a helping hand, you're going to be there. But if they eat McDonald's 4 times a day, drink 3 liters of Coca-Cola and smoke a pack of cigarettes, I think a lot of libertarians might go, sorry, mate, like, you did this to yourself. Like, as cruel and unheartless as that might sound coming from my mouth, I think a lot of people will kind of look at this and go, you reap what you sow. I think that is a fair statement, right? So
Totally
what you're
fair.
describing,
and in the United States, if you get canceled for saying that.
Oh yeah, absolutely. I'm sure I would be tarred and feathered and pitchforked if I opened my mouth in the United States and had to deal with these people. Luckily, I live overseas and I live in a conservative country and I can speak my mind. I don't have to self-censor on these types of things.
Yeah.
But really what you described is a Venn diagram of me and my people in my community. We've got our Bitcoin people. We have a lot of chiropractors, alternative health, personal responsibility. We got the agorist, libertarian, and cap, philosophy, do not encroach on other people or their property. I mean, add the international piece to that, and them's my peeps, like these are my people here that we're discussing.
Amen. Yeah, I don't think people, I think people who, get up early, an extra hour early, they go work out, they come home, they eat what they should be eating, they resist the urge to put garbage into their bodies. They are paying a price for that, right? They are paying a pleasure price for that, because getting up early and going working out hurts, right? And they don't want to subsidize people who are making significantly different lifestyle choices. And I personally don't think they should. And so we've got a community of people. The BMI is about 5 points lower than the national average. To get into one of our crowds, you actually have to have a visceral fat of almost zero. You have to have a fasting insulin below 5. Like, you've got to be metabolically healthy to be a part of that community. And what we have found actually too is people who aren't that metabolically healthy are actually taking steps to get themselves to be metabolically healthy so that they can get into this community and they can reap the rewards of taking care of themselves. And this is like very specifically in your monthly rate. You are paying significantly less if you're a part of this community than you are with a general health insurance plan who's paying for the, $1 trillion of diabetes, type 2 diabetes expenses. That is mostly 95% of which is just a lifestyle. It's a lifestyle disease, and so they don't want to pay for that stuff because they're like, I'm getting up early in the morning. I'm deciding to put good stuff in my body as opposed to, munching on, Doritos all day long. And I think they should reap those rewards. So that's a very different concept than most people, look at. Auto insurance. If you're a bad driver, you should be paying higher for your auto insurance. If you're a good driver, you shouldn't be. Nobody has any problem with that, right? But when we say it for healthcare, if you're a good lifestyle, you should be paying less. If you have a bad lifestyle, you should be paying more. For some reason, people have a huge problem with that. And I think there's not that much difference. And shit happens to good people and bad people, people who have good lifestyles and bad lifestyles. For us, we're for the people who have the good lifestyles. If you fall off a bike and you smack your head on the concrete, that's going to happen. I would be more than happy to help you with that. Like, I love that you're outside doing stuff. If you have a baby, heck yeah, I want to help you have a baby. Like, let's populate this planet. But bad stuff is going to happen, like colon cancer that you didn't. There's nothing you can do about colon cancer. Like, that's not a lifestyle change for the most part.
Exactly.
So, I have no problem helping somebody else with just like, you just got a bad deck. Like, you got a bad hand, right? And I'm happy to help you with a bad hand because that's not self-induced. It's the self-induced things that I have a problem paying for.
Absolutely. And on the point, I absolutely love it. Have more kids, have more babies. Families are important. Kids are important. I hate this Malthusian crap that's coming out of some people's mouth where there's too many people on planet Earth or we're going to consume everything. We're destroying the planet. It's absolutely rubbish. What we need to have is good families, honest and ethical families who support each other, who help each other. Go out there, make babies. Don't feel like it's selfish. It's not racist to have kids or anything like this. Like, go out there and have families and take care of one another. Like, full stop. I'm so for it. Absolutely.
Yeah. I'll give you a quick stat that I think will be interesting, and I think will explain kind of our community. In the United States, about 1.6% of babies are born at home. 1.6% across all 3 million babies in the United States that are born every year. In CrowdHealth, it's about 40%. So we are about more than 20%. 20 times the national average in terms of babies being born at home. Our community is like, I do not want to be a part of this, crazy hospital stuff where they force you to inject, things for diseases that can only be sexually transmitted into a baby. Like, what the hell is that? Like, that makes no sense. And so, that's our community, and I love being a part of it.
Yeah, there's so many weird things that go on with children and the schedule of vaccines and things. You learn about it and it's not what it was when you and I were growing up. Like, I kind of think back to how I grew up as a child and then seeing the schedule of vaccines for kids in today's day and age, you're like, whoa, there's something really, really wrong here.
Yeah. And that's what I was back saying to the Amish group in Pennsylvania and parts of Ohio here in the United States. They don't do vaccines, and they have 0 kids with autism, 0 kids with ADHD. Somebody was in front of Congress the other day and said, we have not been able to find a person with autism or ADHD that has not been vaccinated, meaning like, all the people who've been, there's no non-vaccinated people that have autism or ADHD. Like they couldn't find any. Like, and so that just tells you like something is going on here. And we have a community of people that is like, we're not for that. We're not for that stuff. So, that's not universal across our community, but it is for sure, given that most people come from the podcast that you're talking about, Tom Woods, Dave Smith, a lot of Bitcoiners, a lot of carnivores, a lot of keto people. They are all, focused on consuming natural things and not putting unnatural things into their bodies. And I think our community benefits from that because they don't have some of the crazy conditions that we're seeing pop up in our healthcare system, and our members don't have to pay for that stuff. So that's one of the benefits.
Well, when we were chatting off air before the interview, and you were like, yeah, I've been interviewed probably about 200 times because I always have to do a bit of a briefing. I don't know, is my guest a first time podcaster? They've been interviewed one time, 10 times, 200 times for you. And then when I started hearing some of the shows, and it was like, you've been on the Bitcoin Standard, I think. I was on the Bitcoin Standard with Safadine. I was on like a lot of them. So it's like, I bet you there was a really, similar crossover of people because I've also been interviewed several hundred times on many people's programs.
Oh, yeah.
And so you kind of curate and pull out the coolest people, and that goes to develop your own community. So I took a stab in the dark, but not an uneducated stab in the dark, that your community had more than just the insurance piece, that there had to be something else there. And it absolutely sounds like my type of people.
Funny enough, most of those people are actually members of CrowdHealth. So, nice. they gotten to know me, and they have like, man, I want to be a member. Like, let's ditch health insurance and become a part of CrowdHealth. And so, I might be the only, person in the United States who I want to see the uninsured rate go up. Everybody else applauds the uninsured rate going down. I want the uninsured rate to go up. That means more people are joining CrowdHealth. It means more people are paying with their own money out of their own wallets and getting way better prices than getting stuck into this health insurance racket. And in fact, we actually have a T-shirt that we give to our members, and on the front it says uninsured. So I was walking through Dallas Fort Worth Airport, one of the largest airports in the planet, right? And I had my uninsured T-shirt on, and everybody was kind of like, "Wait, what? What do you, that doesn't make a whole lot of sense," but it stirs up really good conversation of why people should actually consider ditching health insurance and becoming uninsured. I think it's actually a very healthy thing to do.
So we've been talking specifically about US healthcare, but from my understanding, this actually can apply for people while they're overseas, while they're traveling. They don't even necessarily need to be American. Maybe you can talk me through a little bit of what that looks like for more of an international space.
Yeah, so the only thing that we require as of right now, and I think we'll be seeing this change here over the next probably 6 to 12 months, but the only thing we need right now is we are built upon United States financial rails, which I don't love. It just is what it is at this point. And so if there's anybody who's listening who is an American who can have a bank account in the United States, then those are the people that we're trying to recruit right now. And actually, we put together a little promo code for you. Hopefully you don't mind. It's Expat. If you put Expat in as your promo code, it's only $99 for the first 3 months. So, you use that promo code and let us know. But you have to be able to get a bank account in the United States as of right now. However, we are looking at going international because we have beyond U.S. citizens, because we have had so much interest from people who are expats, who are living in countries who have horrible healthcare systems. And so we will be opening that up probably within the next 6 to 12 months. And so I'll give you a link that you can put in your show notes to have people who are interested in this, who are not U.S. citizens, let us know that they are interested. So when we get that rolled out, we can let you know. It is trying to release ourselves from the other super centralized component of our lives in the United States. And I know in pretty much every country, it's, the financial systems that we have to deal with and the payment processing systems and things like that. So once we get that finalized, we'll be rolling out to anybody. But anybody who is a U.S. citizen, who you can use this abroad, you just have to be able to get a U.S. bank account. That's pretty easy to do. So that's who we're focused on right now. But again, if you're interested, let us know. We'll put a link, here in show notes. I'll send it over to you.
Yeah, absolutely. And even feel free to plug the website. So if people are listening to this on the audio only version, they can just go right to the website and check this out.
Yeah, joincrowdhealth.com is where you'll find us. Again, use Expat, EXPAT as your promo code to get something, a little bit off there for the first few months. And our pricing structure is pretty simple. So it's $135 a person. It's $185 a person for a single individual. It's about $600 for a family of four. Once we get enough people internationally, so we can actually build an international crowd. As everybody knows, the cost of doing business in healthcare outside the United States is significantly lower than in the United States. So we think we can get those down significantly if we can get, about 2,000. We need about 2,000 people to be interested in an international expansion before we can go. We have about 8,000 people that have signed up thus far. So it's, if we can add another 25% and they're all international, then we'll be able to build that international community and actually have a viable community of people. Because what we want is, if you have, we just had we've had a couple members with non-Hodgkin's lymphoma, which is a really expensive, form of cancer. The drugs, at least in the United States, are $20,000 or $30,000 a month. We want to have enough people in that community that you can viably pay for the really big ones. So our biggest bill thus far has been hundreds of thousands of dollars. And so, pretty significant. And so you have to have a group of people that you can spread that around and say, hey, can you help? And so we just want a large enough group to be viable outside of the United States. So we're building that, and you go to joincrowdhealth.com and look for the different crowds up at the top. And you can go down and say international crowd, and you can let us know where you live, what your contact info is, and so we can reach out to you when we've got that going.
Well, not that I don't have like 9 million things on my plate, but maybe I'll spearhead an expat version of this, and we'll joint venture on a project in the future. We'll have our own little expat community.
Oh, man, I would love it.
Healthcare. That'd be pretty rad. I'd say a lot of my people are living in Latin America.
I'd love it. I get a lot of people from Argentina, Brazil, Colombia, reaching out to us for whatever reason. Those are those countries that a lot of people. Brazil is actually the number one, because I think the healthcare there is so horrible. So, I would love to chat with you or anybody else out there who's interested in doing some things abroad. I'd love to chat just to understand that better. Because I think there's a huge opportunity there from what I've gathered, and people just hitting me up on Twitter. By the way, you're interested in following us. Twitter is Join Crowd Health. Instagram is Join Crowd Health. We do a lot of fun memes and things like that of making fun of our healthcare system. But we'd love for you to join us there as well.
Brilliant. Andy, amazing conversation. I love the work that you're doing. Thanks so much for your time today and coming on and explaining to us your processes and what you're building and what you're creating. I think it's amazing. I'm super bullish about the whole thing. It sounds fantastic. Give us that website one more time so people can go and find it.
Joincrowdhealth.com.
Amazing. Andy, thank you so much. Have a great rest of the day.
Thanks, man.